everyone, Dr. Michelle here, and I'm going to be doing today's testimonial, my second one. I was my first one, and now I'm going to share a patient that I treated at the hospital some years back, and what used to do the preoperative joint class at the hospital, and this was to educate patients before their surgery. The surgeries were primarily total hip, knee, and shoulder replacements. And I would come in and do my little portion of the class and teach them about how acupuncture can help in many ways around their surgical procedure, both preoperatively and postoperatively. So that was a really great opportunity. I used to go in every week and be able to share with the patients, educate, and then also provide a little mini sampler at the end, complimentary, so they could try it out and then they could sign up and schedule for their acupuncture procedure before and after surgery. Excuse me. I have not gotten my water in today, so I've been very busy with medical course work in a 4-day medical seminar. So it was a really exciting time to be able to empower these patients and give them more options around their medicine and treatment. This could help possibly reduce their pain medication intake, which could greatly improve their health and also reduce the risk of pain medicine addiction. So a little side note on that was during this time, the Joint Commission had actually mandated that doctors start recommending to their patients integrative medicine, such as acupuncture therapies, so as to prevent the opioid epidemic addiction that was occurring, or that has been occurring. And so that was a really great movement in being able to start having that in Western medicine facilities, accredited hospitals, etc. So it was nice to share with patients this, option and how it could reduce the possibility around opioid use and addiction. So just wanted to throw that in there. So this is a female patient that I was introduced to at the surgery class. And she was scheduled to have total knee replacement. And this was a first. She was going to have both of her knees done at the same time. So really huge. You can imagine she was in a lot of pain, and she was 10 out of 10 with her pain level. Very difficult for her to ambulate, to walk around, and she was scheduled for surgery 2 weeks out from the date of class, which is pretty common for a lot of these patients. They were going to have surgery a few weeks out from the preoperative class. Let's see. So she was a middle-aged woman, and she had complained of a long time pain and a lot of pain. After class, she had the mini sampler that I offered of acupuncture. And I also applied ear seeds for the patients in that class too. So if people were afraid of needles, they could start with ear acupressure when we put the little stick-ons on the ear. And I do have videos in my Chinese medicine playlist, and I think I have ear seed auriculotherapy playlist as well, so you can learn about ear seeds on my YouTube channel. But I had provided both ear seed, ear acupressure treatment, and acupuncture, so patients would have options. And then I also offered essential oil therapy, so for pain or whatever they might be needing, mood, for stress, anxiety, etc. So they had more options to choose from in that little mini sampler class, which was pretty cool. And it was all complimentary. So she had the little acupuncture sampler that I provided, again, it was pretty short and sweet. They probably would have the needles retained for about 15 minutes. The primary target would be on their ears, and then I might do some other points that would help support with pain. I didn't do a whole lot of local treatment in the mini sampler class like I do when patients come and see me. So she did have minimal relief, and she decided to schedule her acupuncture appointment both in the office before her surgery and then also post-operatively. She scheduled appointments, and I'll go through what that treatment regimen was. So she had, let's see, appointment in the office. Yeah, so I think she had either 1 or 2 appointments before her surgery procedure. And this was to treat both her pain in her knees and then also to treat pre-op stress, which is very common with surgery patients. They usually will have fear, anxiety, and stress. Maybe a little bit of depression, but that usually creeps in after surgery. So when she left her appointment with me pre-operatively, her pain level was still a 10 out of 10 before treatment. And then when she left her first appointment, she was a 5 out of 10. So that is pretty great. We reduced her pain by 50%. She was able to walk more steadier, with greater confidence, and with greater ease out of the office. She was very relaxed and calm and looked happy and was looking forward to seeing me in the hospital to treat her for her post-operative care. Let's see. Okay, so on to her surgery date, fast forward 2 weeks. Or a week, she was scheduled for her acupuncture treatment in the hospital. I could go out the day of surgery. It would usually be in the evening after they got settled. And I always tried to do her treatments after she went through her physical therapy, which was usually morning or early daytime. So I'd always try to schedule my acupuncture appointments for my patients a little bit later so they could really get the full on effect of the treatment. So she was in her room after surgery the same day of, and I came out to see her. And when the patients come out of surgery like that, usually the first week or so, they're going to be bandaged and wrapped. So you're still not going to be able to treat locally. So again, I go for the ears, which has points specific to shoulder, to knees, to low back, depending on where their surgery area is. And we can treat that right on the ears with acupuncture. And then I would also do points distally, so away from the surgery site. That would help reduce inflammation and pain. And then also to detoxify from anesthesia, to provide, a lot of times patients will come out of surgery with nausea from the anesthesia. So I could treat the nausea. For her, I don't think she had nausea, but really great for treating nausea post-surgically and just getting the medications moving out of the system. And then to boost their immune system is also important to really help the healing process. So those are some of the target areas that I focus on in the initial treatment phase with acupuncture. After, let's see. Oh, okay. So I'm going ahead of my notes here. So she had acupuncture day 1, the day of surgery, and then I'm pretty sure I went back 1 or 2 more days. So either day 2 and 3, or just day 1 and 2, the day of surgery and the day after. This helped to decrease her pain and inflammation and really start the healing process. It also could help reduce some of the pain medication that she needed. And it also helped to calm her post-operatively. So it really helped to boost her spirits. And it also helps the patients to sleep. So, because it can be really hard to get rest when you're in the hospital. She then followed up in the office post-operatively when she was discharged from the hospital. She had weekly treatments to decrease pain and swelling. And on a side note on that, I usually recommend patients can come in every day. However, it might be hard for them to come in. And I do offer home care. So I have treated some post-op patients on a daily basis. Once they got home, could go out and I would treat them every day or every week to really accelerate the healing process. But while she was in the hospital, or when she was discharged from the hospital, she was coming into our office post-operatively, and she was coming in weekly. And this was to decrease her pain, swelling, increase range of motion. And this is really important because they're also getting physical therapy treatment, which is really working to get to a certain mobility state. And the quicker you can do that, the better you're healing and the faster you're healing. So it increased her range of motion and helped to accelerate her overall healing process. After repairing and stabilizing her condition, she then came in for maintenance therapy. So that might have been like once a week, could have been twice a week, but I think she was coming in once a week, then maybe once every other week, and then probably a couple times a week to monthly. This included weekly, bi-monthly, and monthly. So overall, she was very pleased. I think I even treated her daughter, who was a nurse, and it was just a really great experience. So on a side note, I don't know if it was that class or not, but just there was another patient which I thought was really neat. She had the mini sampler too, and she was scheduled for surgery. I can't remember if it was for her knees or her hip. I'm not sure. But nonetheless, she had the mini sampler appointment. She was so excited that these services were being offered, and she decided to go Eastern medicine and cancel her surgery. So, not promoting that, but I'm just saying it is an alternative. And sometimes, if you reduce a patient's pain level, even if it's by 1/4, that can greatly affect their the way that they're getting around in life. And it can give them a lot of hope, and it can potentially treat the underlying condition. So, something to consider if you have not tried all the conservative therapies out there, to do that first. And then when you are ready for surgery, I always have recommended to my patients, unless you already have one great recommendation and referral, uh, you can never get too many consultations and opinions. So I usually recommend at least 3 surgical doctor consultations, and compare them and see which one is going to be the best fit for you if you are going to have surgery. So I hope that you enjoyed today's testimonial on knees and surgery. And please spread the word that Dr. Michelle's out here, because that's how the channel grows. That's how we get the education out to patients and people. And I also do animals. But it gets the word out, helps Dr. Michelle's channel to grow. And when it grows, that means we're getting more education out to the public. So a lot of people do not know how beneficial alternative medicines can be. And that's why I started my channel, is to empower patients around their health and give them more tools in their toolbox to help them start healing and really empower them. When you have more options and you have knowledge, it can really empower you. So anyhow, I wish you many blessings. I'm here for you. Reach out if you need me. Remember to hit the subscribe button please add in a comment or a question. If there's any topics you'd like me to add for any videos, also you can email me, or if you'd like to be a guest on one of my lives for today's testimonial or a trauma. I'm also doing trauma talks. Send me a message, and I put all that in the description in the video today. So many blessings. Take good care of yourself, and ciao for now.